Bismillahirrahmanirrahim. Assalamu alaikum, dear student. Today topic is the continuation of shock or circulatory failure. Before going to main topics of the shock, I would like to repeat the definition of shock. Shock, generalized inadequate blood flow throughout the body, resulting tissue or damage due to low oxygen and other nutrients delivery to the tissue, or a level of oxygen delivery which fails to meet the metabolic requirement of the tissue. Or another way, shock is the systemic state of low tissue perfusion which is inadequate for normal cellular respiration. Now come to the main topics. Today is the stages of shock. Stages of shock. Shock having three stages. One is non-progressive, which is another name is compensatory stage. Another is progressive shock. Another is irreversible shock. Non-progressive shock is another name is compensatory shock or compensatory stage. It can be compensated by several factors. One is baroreceptor reflexes. Another is CNS ischemic response. Another is reverse stress relaxation of the circulatory system. Fourth one is increased secretion of renin and angiotensin 2. Fifth one is increased secretion of vasopressin or ADH. Increased secretion of epinephrine and non-epinephrine. And last one is compensatory mechanism that return the blood volume back towards the normal. Now, if you see the picture of how the shock will be compensated, you have learned in first or second lecture that has given by Salma Man. You know the cardiac output is 5 liters per minute. If you lose 1 liter of blood, suppose this is the 1 liter of blood is lost from your body, the body can be compensated by its own mechanism. What are the mechanism? You see, 1 liter of blood has been lost, then body compensated by its own mechanism that returns to normal. How it will be normal? By these factors. What are the factors? Baroreceptor reflexes. What is baroreceptor? When the fall of blood pressure of shock, the baroreceptor will be stimulated, sympathetic nerve will be stimulated, that it increase the vasomotor tone, increase peripheral resistance, increase cardiac output, and that is a shock will be managed. Then CNS ischemic response, it is not stimulated until blood pressure fall below 50 millimeter of mercury. Now come to the reverse stress relaxation of circulatory system. What does it mean? It means when there is a shock, some vital organ that needs more blood. Which are vital organ? Brain, heart, and renal system. And other blood vessels are constricted and these vessels are dilated. Which blood vessels? Brain, heart, lung, and renal system. These blood vessels will be dilated, and blood vessels in the GI tract and blood vessels in the skin will be constricted. That blood diverted to this system, and this system provide blood to the vital organ. Now you know the increased secretion of renin angiotensin, you know this. Another is vasopressin, you know, increased secretion of epinephrine and non-epinephrine, and compensatory mechanism that return the blood volume back towards the normal. Now, which system acts quickly? First is baroreceptors, CNS ischemic response, and increased secretion of epinephrine and norepinephrine. It acts within 30 seconds to few minutes. Next is reverse stress relaxation of circulation system, increased secretion of renin-angiotensin mechanism, increased secretion of vasopressin. It needs some time, at least half an hour or 10 minutes to 1 hour. These three will act within the 10 minutes and to 1 hour. These one, the compensating mechanism, return the blood volume back towards the normal. It needs about 1 to 48 hours. What are the changes that place, that is from this normal blood volume? First, it will increase the absorption of fluid from the interstitial space. Another, it increase the absorption of fluid from GI tract. Also, it increase the reabsorption of fluid from the renal tubules. And sometimes the patient feels thirst, then he drinks more water, and sometimes he eats more salt. That will cover this. It needs about 1 to 48 hours. Now, progressive shock. Progressive shock, without treatment, it becomes worse. These don't need any compensation, no need to support from outside. These need to support outside, and without support, it becomes to irreversible shock. Now come to the irreversible stage of shock. Before going to explanation of this stage, I want to mention that non-progressive or compensatory stage can be compensated by negative feedback mechanism. Now come to the irreversible stage of shock. If you see this flow chart, then you can understand that what is the irreversible stage of shock. Its another name is vicious cycle or positive feedback mechanism. Now first it is the decreased cardiac output. As a result, decreased arterial pressure. Next, it is the decreased systemic blood flow. Then it will affect three. One is intravascular clotting, another decreased nutritional of the tissue, and decreased cardiac nutrition. Now come to the intravascular clotting. One intravascular clotting, that is called decreased venous return. When venous return is decreased, it again go to the decreased cardiac output. Now come to the decreased nutrition of the tissue. Another is decreased cardiac nutrition. What does it affect? Cardiac also. Now decreased nutrition of the tissue, it will change the decreased nutrition of brain, decreased vasomotor activity, vascular dilatation, and venous pooling of the blood. When venous pooling of the blood, it will decrease the venous return. Then when decrease venous return, it will decrease cardiac output. Now come to the decreased nutrition of the tissue. It will affect three stages. One is tissue ischemia. When tissue ischemia, it will release some toxin substance, release of toxins that will cause a dilatation of the vessels. And also, this toxin will depress the cardiac depression, and again it will change the decreased cardiac output. Now come to the decreased nutrition of the vessels. When decreased nutrition of the vessel is causes vasodilatation, and again it also increase capillary permeability. When increased capillary permeability, it causes decreased blood volume. When decreased blood volume, decreased venous return. Decreased venous return causes decreased cardiac output. Now you see, this is the positive feedback mechanism or irreversible shock, or it is another name is vicious cycle. If you see the picture of these, the vicious cycle is ultimately the death. This is the stages of shock, and shock, how it is compensated. I have explained this. Thank you. My dear student, if you do not understand, if you don't understand, you go to the book and see the book. If you see once, you can understand what is shock, what is the classification of shock, how the shock will be staged, and how the different stages of shock can be compensated. Thank you. See you again, inshallah.